Now, after Hurricane Melissa, Jamaica faces a risk of waterborne diseases due to potential contamination of water sources. Key diseases to watch out for include cholera, typhoid fever, leptospirosis, gastroenteritis, and hepatitis A. Prevention methods like boiling water, proper hygiene, and avoiding contaminated sources are crucial, especially for vulnerable populations like children and the elderly and those with weakened immune systems. This morning, we're very pleased to be joined by Dr. Rochelle Johnson, a medical doctor, and she will share more information on waterborne diseases. Good morning to you, Dr. Johnson, and how are you today?
Good morning. Thank you for having me.
Glad to have you.
Thank you.
All right. We're very happy to have you this morning, Doc. And we're at a stage after the hurricane, especially in Western Jamaica, that I guess water settles and that can cause problems. Why is it important to be aware, and what is some of the information you wish to share on waterborne diseases in a general way?
Right. So as you mentioned before, with the passage of Hurricane Melissa, there are many communities that would have experienced flooding, disruption of the clean water system, and also damaged infrastructure. These conditions, will increase the risk of waterborne diseases, and you listed some earlier: cholera, typhoid fever, leptospirosis, gastroenteritis, hepatitis A, and we'll jump into some symptoms, treatments, how to prevent these, the risk factors, and also the vulnerable population. Okay. So let's talk about cholera.
Okay.
So cholera is a bacterial infection. It affects pretty much the small intestine. Now, when I say the small intestine, we're talking about the stomach. It is transmitted when food or water becomes contaminated by stool or feces, meaning poop. Some symptoms that you may experience, firstly, which is a hallmark sign of cholera, is a sudden onset of watery stool. This watery stool is characteristic of a rice watery stool. Like when you wash the rice, that white water that comes off, that's what the stool will look like. And it can lead to severe dehydration. And these signs of dehydration that one may experience includes excessive thirst, dry or choppy lips, the eyes may become sunken, they may become severely weak. One may also experience vomiting. And let us note that these symptoms may move from being mild to very severe. And in severe cases, these can lead to death in a matter of hours.
Wow.
That's not something that we need to be taken lightly. In mild cases, you're trying oral rehydration salts at home and you realize that this watery stool continues, make your way to the hospital. All right? How do we prevent cholera? As with most bacterial infections or waterborne infections, avoid drinking or eating food that has become contaminated by flood waters. We have to implore that you practice safe sanitation or proper hygiene. Proper disposal of the stool or feces is essential. And it's also important that we wash and sanitize our hands after using the bathroom.
Go ahead, Doc. Go ahead. Yes?
Right. Some groups that may become vulnerable or are vulnerable to cholera include children, the elderly, pregnant women, and people who their immune system are severely compromised. You were about to ask?
Yes. I'm trying to figure how are these treated, and how long does it stay with an individual, even if that individual is being treated?
I mean, cases can move from being mild to severe and can last from days to weeks, and can even have result in severe damage to organs in the body that can lead to even months after being treated.
And generally speaking, how are these treated?
intravenous fluids in the hospital, antibiotic therapy in the cases of bacterial infections, symptomatic treatment. If there's vomiting, there's diarrhea, we need to put medication that will prevent the diarrhea, that will stop the vomiting. So each case will require different treatment based on the severity and also based on the symptoms that the patient is experiencing.
Okay. So I want you to expand a little bit, if you will, Doc, on the precautions that individuals should take, and even healthcare workers themselves who have to interact with these patients.
Right. So there are oral vaccines that can prevent cholera if accessible to patients and also to healthcare workers. But for the layman and for the people out there in the communities who don't have access to these vaccines, they can practice hygiene cares such as boiling the water, adding bleach in proper dosage. For example, a 1 gallon of water, in order to purify this water using bleach, chlorine, you need to add at least 8 drops if the water is clean. Stir it up, leave it for about 30 minutes, and then that water can be used whether for drinking or for other purposes. If the water is cloudy, you need to add at least 16 drops to 1 gallon of water. Just the same, stir it up, allow it to stand for 30 minutes, and that water can be used as well. There are also purification tablets that you can put in the water, and that's if these are accessible to people out there in the communities that are severely affected.
Thank you for sharing those tips with us. Doc, I want to ask now, can these diseases be transmitted person to person?
Sure. Remember that there are symptoms that vomiting, diarrhea, stool become, a patient's stool who is infected can pass stool if they become contaminated or if they come in contact with a healthy person or any person out there who is in the vulnerable group.
And are you finding, based on your information, that you have more cases of waterborne diseases since the hurricane?
Yes, we have definitely been seeing a lot of more cases of waterborne diseases, especially gastroenteritis. And this is on our side in Kingston. But I'm sure in the western side, they might be picking up more on symptoms similar to those of cholera or typhoid fever or even gastroenteritis themselves in more severe cases.
So once people are seeing these symptoms as you described earlier, what should they do? I suspect don't try the home remedies. Try to head to a medical professional, wouldn't you say?
Head to a medical professional, whether it is a health center or the hospital, and now they will determine what type of treatment is required based on the symptoms and the severity of the symptoms that you're experiencing.
Are vaccines currently available here should persons become infected?
In Jamaica?
Yes.
I would have to check on that information, but I know that it is readily accessible in other countries. But we need to check on that information regarding Ministry of Health.
All right. I really learned a lot from you this morning. What is your parting shot for us this morning, Doc? What do you want to leave with us?
It is very important that we practice proper hygiene, right? Dispose properly of the stool. I know that most bathrooms, most infrastructures in the home are destroyed, but it is very important that we ensure that we protect each other, that we dispose properly of our stool, dispose properly of animal waste, because these are things that can cause serious implications on our vulnerable groups. Also, you know, I thought about it and I was like, how do we tell somebody who has lost everything and need to walk through these murky waters to go and find food, not to walk in the waters? But what we can implore is that if you don't have to, please avoid it. There are children who are playing in the dirty water. Please avoid the children from playing in the dirty water. Help them teach them how to sanitize properly, especially after using the bathroom. And if you are experiencing any of these symptoms, I'd advise that you seek medical attention immediately.
And on that note, I want to say thank you very, very much, Dr. Johnson, for the information you shared and for the time spent. And we learned a lot. Thank you so much, and you have a good day.